Hi guys, Dr.H here, your source of advanced musculoskeletal care, and today's topic is prolotherapy. So this is actually an injection technique and not so much of a hands-on therapy or technique. So let's talk about that. Alright, so like I said, prolotherapy is actually a series of injections. Now before I go into what exactly is going on with these injections, let me talk about when or why we might do this. So to talk about that, we need to talk about, let's say, an acute injury. So let's say you sprain a ligament or a tendon in your body. When that happens, your body has a natural progression to try to heal that ligament or tendon. However, it only dedicates a certain amount of time to doing this. After said time, you're kind of left with what you got. So we have this sort of saying, things can finish healing before they've entirely healed or healed completely. And because of this, you're left with an area that's looser, not as stable. Its tensegrity and its structure is very much disrupted. Now the thing about hands-on treatment is, yes, we can use it to balance out tensegrity and give you structure and function, but there's not too many things that I can do to tighten up an area that's too loose. So if you have a ligament that has been stretched and didn't really retighten up properly, one thing we can actually do, might seem a little counterintuitive, but one thing we can actually do is go back and injure it again. Now that doesn't mean I'm going to take your ankle and sprain it again for you. What we can do is we can inject it with an irritating solution. So that's what prolotherapy is. Sometimes you'll hear it called regenerative therapy because in the long run it helps actually regenerate or strengthen that tendon or ligament. We'll get to that in a second. But what prolotherapy is doing is introducing some kind of irritant in a very localized manner to try to instigate and restart that healing process again. Now, with prolotherapy, you can use all kinds of things for your injectable material. You may have heard of stem cell injection. You may have heard of platelet-rich plasma or PRP injections. It's kind of all the rage right now in sports medicine. Traditionally, though, we use just sugar water, dextrose, and lidocaine. It's actually the dextrose, the sugar water, that is an irritant. So what the sugar water does is irritates the ligament, actually causes a little area of inflammation. And the body will start to heal that area again. And it's kind of like extending that period of time that your body took to heal that ligament to begin with. So let's say you sprain a ligament, your body takes 6 weeks trying to heal it. After 6 weeks, it's like, it is what it is. And then you're left with this, let's say it was in your ankle, you're left with this unstable ankle, and you keep rolling it and rolling it. Or maybe it's in your back and your vertebrae are now no longer stable and you're getting pain there, or in your SI joint, wherever. And your body is done trying to make it better. What we can do is we can inject this dextrose and lidocaine, the sugar water and numbing agent, into the area, restart the inflammatory process, restart the healing process, and hopefully make that ligament stronger and denser and make that whole area more stable and tighter. So they've done a lot of studies with prolotherapy. Some of them are a little bit disturbing, where they were done on rabbits, and they inject the rabbit with proliferant, and then they sacrifice the poor rabbits, and then tear apart this tendon to see how much force it takes to do it. And so what the study found was the tendons that have gotten this prolotherapy done to them were much stronger and denser and took a lot more force to tear apart than the ones that didn't receive prolotherapy. Today's studies are more clinically based, so you have people with arthritis of the knee, old ankle injuries, stuff like that, elbow injuries, even like tennis elbow or lateral epicondylalgia, where they do this prolotherapy and show promising results. Another study that you see this done, and where I do it a lot, is actually in the TMJ. So people who have TMJ syndrome can get prolotherapy into the TM joint, the temporomandibular joint up here, and help improve the pain with their TMJ. So what does prolotherapy entail in terms of actually getting it done to you? It's usually more than one injection. It's not like a steroid shot where you get one injection to the knee and you're done. Usually it's a series of injections or different injection locations around the joint that you're targeting. It doesn't have to be a whole bunch of them. It depends on kind of where you've trained in prolotherapy and what your philosophy of it is. There are some people who will do a ton of injections. If they're doing the back, they'll do just tons and tons and tons up and down the back, trying to shotgun it and get everything. I tend to do it a little bit more focused. I'll do the area in question, maybe a little bit above it, a little bit below it, to kind of add stability to the whole segment. To give you an idea of what a prolotherapy session might look like, I filmed one with a patient who has pain in her big toe. is starting to form a bunion and also has another problem with her big toe where it's jamming up when she walks and it was giving her pain. And so we've been doing prolotherapy. So I'll actually show you that now. So we're going to demonstrate prolotherapy. I've got a willing participant here who I'm going to be doing prolo to the first big toe area here. There's kind of two things going on with this big toe to give you a little bit of a background. It's painful because this bone right here in the foot is actually a little longer than it's supposed to be. And she's also getting a little bit of a bunion formation right here too. Now to be clear, prolotherapy cannot cure bunions. The only thing that can fix bunions so far, at least that we have, is surgery. But prolotherapy has been helping give her pain relief. Known now in medicine that injecting joints over and over and over again with corticosteroids, which can also give her pain relief, can actually be harmful for the joint. And so prolotherapy is a little bit of a better alternative to this. So we're going to demonstrate what is involved in that now. Okay, so we're going to begin the prolotherapy injection. I've kind of marked off the area here that I'm going to inject. This will be 3 injections. There'll be 1 inside the joint itself and then 2 going up the toe here to kind of strengthen the tissue that goes right along this toe here. All right, so we've cleaned the area. I've got a cooling spray here that's going to help with the needle stick pain. So I'm just going to spray this cooling spray. Okay. That's usually the worst part. Okay, we're going to do 2 injections, 1 here. Okay. And that's all there is to it. That's the prolotherapy injection for the big toe. That's what prolotherapy looks like. As you saw, it was only about 3 injections. The worst part was spraying the cold spray, and it was over pretty quickly. So the advantage that prolotherapy has compared to maybe other injection therapies like steroid injections is the solution that you're injecting, while irritating, while possibly inflammatory, has not at least been shown to degrade your joints, whereas corticosteroids like glucocorticoid injections into your knees or wherever you might be getting them have been shown to deteriorate joints. There was actually an article not too long ago that was published showing that it might do this a little bit faster than we think. It might actually be contributing to needing joint replacements sooner than otherwise. It can make you feel better because the steroid's anti-inflammatory, so all the painful inflammation in that joint goes away when you inject steroids, but it doesn't actually help fix the problem. This is opposed to prolotherapy that may actually help fix the problem. If your problem is loose tendons, ligaments, or wear and tear on your bones, and we do prolotherapy to help kind of bring the immune system and your body's healing process into the equation again, your body can help repair that area and actually fix the problem. So we already talked about a few areas we can do prolotherapy to. The most common ones are probably the knees, the shoulders, ankles, hands. Like I said, you can do them to the jaw for TMJ. I do them to the back a lot because people have old back injuries and now have unstable segments of the back. And we talked in the tensegrity video, which I can link up here, and the back pain video, which I can also link up here, that when you have an area of your back that's kind of broken and lost its tensegrity, everything else will kind of cinch into that area to stabilize it and give you pain. And so going in there and injecting it with proliferant and trying to increase its stability can help take away that compensation factor and take away your pain. So after you get a prolotherapy injection, the few things to keep in mind, we're trying to create a little bit of an inflammatory process, so I often advise patients not to take things like steroids or even non-steroidal anti-inflammatory medications like ibuprofen, Aleve, aspirin. Tylenol is fine because it doesn't have an anti-inflammatory component. Ice can be beneficial for the immediate pain, so that's okay. And then we always do OMT, or osteopathic manipulative treatment, hands-on work, after we do prolotherapy, because the idea is if we're helping to rebuild these ligaments and tendons, we want them to rebuild in the right orientation and with the right structure. And so it's important that the tensegrity of that area be optimal when we're doing this injection so that things repair and strengthen the way we want them to. So that's prolotherapy. So like I said, it's an injection technique, not a hands-on technique like our last video on HVLA was. But this is important to understand because not many people know about it, and it can be a very, very useful tool for helping to fix musculoskeletal problems. Until next time, keep moving.